Well, I'm the founder and CEO of Victory Dental Management, and I absolutely love, actually, I'm privileged to do what I do. And being able to help practices reach their full potential is really my passion. And that comes in a lot of different forms. You can imagine working with dental practices, there are a lot of different things that come together, not only for the doctor to be looking at our relationship as a success, but also, what goals does that particular doctor have? And I like to look at things, Jason, really differently than most, because I try to use the experience that I've had, whether it be working in different industries, as well as what I absolutely love to do outside of the dental world. Now, that is coaching girls basketball. And I've coached every level from elementary to AAU. And for those of you that are viewing this video, if you're not sure what AAU is, think of it as the girls that are going to play Division I basketball, the best of the best through the high school years. So being able to coach that from a basketball and competitive standpoint, and to be able to overlay that with a dental team, that's what I think separates me and makes me unique within the dental space, because not everybody has ever coached basketball. In fact, I've never met another dental consultant that has actually coached another basketball team. Absolutely. I would say the biggest thing would be every season as a coach, I get players in front of me that may or may not know one another, that may or may not have played at all together. So how do you form a team from individuals? So that could be walking into a new client that has had employees there for over 20 years, or that could be they just had a new hire. How do we get this person, into our practice and understanding how we like to do things? And you can imagine with your football background, and what you know about dentistry and different practices that you work with, from my perspective, I think every doctor I've ever worked with has said, Lynn, I have a team. Well, my threshold to be able to say you have a team is higher than most, because if you really truly had a true team working for you, you wouldn't have the things slip through the cracks, and you wouldn't need a consultant or coach to come in, because if you had a true team, the things that doctors typically come and complain to me about wouldn't be an issue. So right off the bat, I'm thinking, okay, we need to take a step backwards and talk about what does it mean to have a team, and then really start filling in the blanks, because I'm a process and systems girl. I love to talk about everybody touching every aspect and roles and responsibilities and different things like that, getting into the micro part of a practice. But before I ever start to do that, Jason, I've got to start more from a 20,000 foot level and say, what are we working with? And are they employees or are they a team? Because they are distinctly two different things. Well, the biggest difference is employees are just a group of people that work for an organization. They have no, it's not that they don't have a buy-in, but it's almost like they're just a small part of a bigger organization. To truly have a team, you're going to have people that understand goals. They understand what they need to do, when they need to do it. It's really relational, because they understand what their aspect of the practice is and how it relates to the profitability of the practice. If they don't have a team, then they're just really going to be frustrated, because the typical things I hear is, why can't they do what I hire them to do? Well, how much time did you spend with the employee when you onboarded them? Do you have a process for that? What does that entail? Because a lot of times it's not a thought out process, and a warm body just doesn't cut it now within the dental world. You need to have a competitive edge. And I think the biggest part that differentiates one practice from another, assuming that clinical skills are on the same level, is going to be your team. And if you really think about it, your team is what represents you for everything that is non-clinical in your practice. Because when the patient is away from you, then they are around the rest of the people that are representing the doctor, and that is your team. So that, I think, is your biggest competitive advantage versus other practices. A lot of times creating a team has to do with the leadership of the doctor anyway. And one of the things that I do is, since I've had so many years of coaching experience within the basketball world and dental world, is I combine that and I want to teach doctors how to coach their own team. And that's not something that is innately a part of dental school or a part of anything else. Or I talk to doctors about, do you want your office manager to be the coach? You know, what structure are we looking for here? So I like to see exactly what the doctor's goals are, because until you can lay out the plan, you don't know where everybody fits within that plan. Because when you actually create a team, then you're talking about practice is when you get to work out all the kinks. And a practice for a dental team is actually going to take place when you're not seeing patients. That's why I strongly advocate having a morning huddle just for communication purposes, but also a monthly team meeting, because you should be busy seeing patients all day long. But you need that separate time to be able to talk to one another as a team. So, you know, you need to differentiate. Game time is when you're seeing patients, and the practice is when you're not seeing patients. That's where everything starts. I mean, I like to look at the doctor as either going to be, it should be really the head coach. And depending on, if you pick any sport, I mean, for me, it's going to be basketball, but you pick a coach that's been successful, you know, season after season, whatever sport that you like. And one of the things that they have is a process. So going through all of that, part of what they're building when they take those individuals, like I referred to earlier, and creating a team out of individuals, you're creating that whole process, which is also culture, to determine what's the end goal. And sometimes I like to start with that, is when I first meet with a doctor and I'm like, okay, Dr. Smith, what is it that you want to accomplish? And then reverse engineer it. Let's go backwards, because let me see what the goal is in mind that you have, and then let's go backwards. You know, that I've had a lot of clients come to me for different reasons, and they may have particular pain points, like why can't the front desk just do what I've asked them to do? Or maybe something is slipping through the cracks and they're having problems with accountability within the team. And when that happens, what I like to do is to take a step back and go, okay, what is it that really is? It's not only the symptom and the cure, but what is the disease? What are we solving here? And typically when I drill it down to that kind of level, it really is, they don't have a team, they have employees. So in order to do that, I'll talk with the doctor about how do we get everybody on board? And that really is a leadership thing, quite honestly, because when I teach a doctor how to coach their team using my multiple years, I'm not even gonna tell you how many years I've actually coached basketball, but it's been an awful lot. All of the coaching on different levels, all of that has been great experience to be able to work with people and be able to work with majority of females, because I coach girls basketball. So the majority of offices are built up of female employees. So I know how the eye rolling is going to go. I know when that wall comes up, what does that really mean? And how to get my point across without having any of those issues. Because when I coach basketball, don't forget, it really is the teenage years. And I will tell you, you either love those years or you hate those years. I really haven't found anybody in between. I love those years. So I'm used to being able to read body language very quickly and know what's happening. But that's really how I work with practices, is looking at it from a strategic level as far as what is it that's happening. And some things that I find, quite honestly, Jason, the doctors have no idea that it's happening. Because when I go in and I observe, there's some things that somebody's going to do to a doctor, or if your back is turned, they're not going to see certain things. So part of it also is not having clear goals or a clear understanding of what am I supposed to do in this position, and how does my role and responsibility in the office relate to somebody else's. Because I like to look at a practice like a set of dominoes. If one's going to fall, then all of them are going to fall, because dentistry is all about relationships. And it's all built on everybody working together so that ultimately the patient has the experience that the doctor wants every patient to have in their practice.